My name is Jennifer Puente. Today is November 1st. I am conducting my head-to-toe assessment on my son Skylar. This is a scanning of the room. That's our bed. And chair. These are my tools. This is our Snellen chart. I'll be using this to hold up my camera. I will begin my head-to-toe assessment with an overall examination or inspection of his skin. I am checking for color, temperature, scars, lesions, nevi, erythema, edema. His skin is warm, dry, and intact. I don't note any abnormalities, upper extremities, anterior, posterior, or bilateral lower extremities or face. I will examine his head. His head is normocephalic, round, symmetric, midline of his body. Examination of his skull and hair revealed his hair to be black and soft. There are no noted infestations. His scalp is smooth with no noted depressions or lesions. Any pain or tenderness with that?
No.
All right, and here on your temporal arteries, any pain or tenderness?
No.
Okay, I will assess his lymph nodes now. Pre-auricular, post-auricular, occipital, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. I will also assess him for TMJ. I'll have you open and close your mouth for me. Good. There is no subluxation, clicking, locking, or grinding noted with that. And I'll have you clench your jaw for me. That tests cranial nerve 5, which is the trigeminal nerve. It is intact as well. I will also test the sensory portion of cranial nerve 5. I'll have you close your eyes for me. Tell me if you feel soft or sharp touch.
Soft. Sharp. Soft. Sharp.
Good. You can open your eyes for me. I will also test cranial nerve 7, which is the facial nerve. I'll have you raise your eyebrows for me. Smile. Frown. Puff out your cheeks. And pucker your lips. And blow out some air for me. Very good. Cranial nerve 7 is intact. I will also have you look toward my hand for me. Good. And look toward my hand for me. Good. Further assessing the facial nerve, I will now begin the examination of his ears. You begin by palpating the pinna and tragus. No noted tenderness or abnormalities with that. I will perform a whisper test. I'll ask you to cover this ear for me. Repeat after me.
A, B, C.
Good. Now cover your other ear and repeat after me.
1, 2, 3.
Good. I will also take the otoscope. I will examine cranial nerve 8, which is the acoustic nerve, and I'll further examine that again with the tuning fork. But here I'm going to be checking his tympanic membrane, and it is pearly gray, translucent. Cone of light is noted. Checking his ears bilaterally. Tympanic membrane here is also pearly gray, translucent, and the cone of light is noted. When testing the Weber test, do you hear this vibration equally in both of your ears?
Yes.
And I will also test Ren. Tell me when you can no longer hear the vibration.
No.
And
No.
air conduction should be greater than bone conduction.
No. No.
I will now begin the examination of his eyes. We will start by testing cranial nerve 2, which is his optic nerve. I will test his central and peripheral vision. I'll ask you to cover your right eye and tell me how many fingers.
2, 4, 1,
Good. Now cover your left eye. How many fingers?
2, 4, 1.
Very good. And now I want you to cover your right eye for me again. And I want you to tell me when you see my fingers.
No.
Okay. And the other. Tell me when you see my fingers.
No.
Good. Cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens, will all be tested at the same time.
I found this on the web.
I will test them by asking you to look forward for me. Just cover. Normal convergence is noted. All right, I want you to follow this with your eyes and not move your head. His cardinal field of gaze is within normal limits and there are no noted extraocular movements. I also am going to have you to take a look at that Snellen chart there for me and cover your right eye and read the largest line that you can read.
DHJBS.
Good, now rotate. Read.
DHJBS.
Good, now with both eyes.
DHJBS.
Good, I'll have you remove your glasses. I'll check and see that his pupils are reactive and equal and round with light. You normally dim the lights for this. His pupils are round, equal, and reactive to light. We'll also take the ophthalmoscope and I will take a look at his retina. Open your eyes wide for me. Good. Good. No woolly bodies or abnormalities noted within the eye. The optic nerve is present. The disc is sharp. I will now begin my examination of his nose. You can place your glasses back on now. Any congestion or problems breathing today?
No.
Good. Will you close your eyes for me and tell me what you smell?
Sharpie marker.
Good. And what do you smell?
Chapstick.
Good. Open your eyes for me. That proves patency of his nose and an intact cranial nerve 2, which is the olfactory nerve. I will also test his frontal and maxillary sinuses. Any pain or tenderness with that?
No.
Good. I will next begin my examination of his mouth. I am looking at his lips and ensuring that everything is symmetric and midline. Open your mouth for me. I am looking at his gums, his teeth, his palate, lips, oral mucosa, and I'll have you say ah. His tonsils are present in grade 0. Normal rise and fall of his uvula and palate with phonation. And stick your tongue out for me and bring it up, down, left, and right. Cranial nerve 12, the hypoglossal, as well as 9 and 10, the glossopharyngeal and vagus nerves appear to all be intact. I will now begin my examination of his neck. His trachea is midline. I don't feel any abnormalities there. I will ask you to lean your head to the right for me. Good, and swallow. Good, and head to the left for me. Good, and swallow. All right, and I don't feel any abnormalities there with his thyroid. I'm going to listen for carotid bruise and palpate a carotid pulse. Carotid pulse is checked 1 at a time. And I will listen for bruise with the bell. I also will go ahead and check range of motion of the neck. I will have you to lean your head left and lean your head right and bring it around in a circle. He has good flexion, extension, and rotation of his neck. I will now turn you around so that we can begin the posterior chest exam. Examination of the posterior chest reveals his chest rise and fall to be equal. There is no tripod positioning noted. There is, here, take a deep breath for me. And release it. Normal rise and fall of his chest. I'll ask you to say 99 when you feel my hands.
99, 99, 99, 99.
No noted tactile firmness. I'm going to be listening to his lung sounds with both the bell and the diaphragm. Asking that you take good deep breaths in and out for me. Ensuring that I get medial and lateral lobes when listening. I will listen for bronchophony, ergophony, and whisper perliquely. And I ask that you say 99 for me when you feel my stethoscope.
99, 99, 99, 99, 99, 99.
Good, and I'll have you to whisper 99 for me. All right, and I'll have you say E for me.
E, 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 E.
There are no noted bronchophony, ergophony, and whisper pectoriloquy is normal. All right, I will now perform the anterior chest exam. I will again listen to the lung sounds anteriorly, and I will check for tactile firmness. Say 99 for me.
99, 99, 99, 99.
Good. Ensuring again to listen laterally and medially. Have you say E for me?
E, 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 E.
Good, and whisper 99 for me.
99, 99.
Good. I will now percuss his lungs in between the intercostal spaces, both posteriorly and anteriorly. Resonance should be heard throughout. I will now listen to the valves of his heart, beginning at the second right intercostal space, listening to the aortic, with both the bell and the diaphragm. Second left intercostal space, listening to the pulmonic, with with both the bell and the diaphragm. Third left intercostal space, herbs point, bell and diaphragm. Fourth right intercostal space, tricuspid, both bell and diaphragm. And the fifth intercostal space, medial of the midclavicular line. Listening to the mitral. Would listen here for 60 seconds to get an apical pulse. His heart rate's 80 and regular. I would then locate PMI. There are no heaves or thrills felt. I will now ask him to lie down for me. I then perform the listening of the valves again with the patient supine. I also at this time check for JVD at the 45-degree angle. Listening again, aortic, pulmonic, herbs point, tricuspid, mitral. I'll also palpate over each of these arteries, ensuring that there are no heaves or thrills felt. I will take the bell and I will listen for bruits in his aorta, renal, iliac, and femoral arteries. I will also examine his stomach. His stomach is flat, symmetric. Navel is midline. And again, listening in the right lower quadrant. I will now palpate, both soft and deep palpation. Any pain or tenderness?
No.
I'll have you take a good deep breath in for me. And release. Good. And I'll have you do it again. Good. And release. Good. I will also percuss. Tympani should be heard throughout, except for dullness over the liver and spleen areas. I will now have you to return to the stool. And I'll have you turn around for me. And I will check for CVA tenderness. Okay, any pain or tenderness with that?
No.
I now will begin my musculoskeletal exam. I will be examining the joints of the shoulders, the elbows, the wrist, and the hands. I will be checking for any edema, any crepitus. There's no edema or crepitus felt. I'll begin by checking his capillary refills in his hands. His capillary refills are less than 3 seconds. I will check radial pulses. Radial pulses are 2+ and regular. I will check range of motion and strength in his hands. I'll have you squeeze my fingers. Good, release. Very good. I'll check strength in his wrist. I'll have you push up against my hands. Good, and turn them over and push down. Good. And then I'll check strength in his elbows. Pull. Good, push. Good, and in the shoulder girdle, make muscles for me. All right, and push up. Good, down. Good, and in your shoulders, up. Good. This also checks cranial nerve 11, which is the accessory. I will now check range of motion in all of these joints. I will have you take your hands, place them out in front of you. Hold your fingers together for me. And when you spread them apart, abduction, bring them together. Adduction, good. Make a fist, flexion, bring it out, extend, and lift your fingers up. Hyperextend, same with your wrist. I'll have you flex downward, good, and extend out. Hyperextend up, and I will have you bring them outward. Ulnar deviation, good. Bring them in, radial deviation, and I'll have you circumduction, rotate. With your elbows, I will have you to flex up, good, extend out, and hyperextend back, good. Same with your shoulders, I will have you to flex, extend, hyperextend, good, bring them back. And I'll have you to reach around, good, and rotate, reach around. It's internal and external rotation, good. I will now be examining the joints of the hips, knees, ankles, and toes. There are also no abnormalities with these joints. I will check capillary refills in his toes. Capillary refills less than 30 seconds. I will check his pulses. Dorsalis pedis, 2+ and normal. Tibial, 2+ and normal. All right, and now I will have you to spread your toes apart for me. Good, and bring them back down. Good. Bring your toes inward, inversion, good, and out, eversion. And I'll have you just kind of make some circles with your feet, yeah. Rotation, good. And I'll have you lift your right foot up and flex your foot down, good. Extend up, good. And do the same with your left, flex down and extend up, good. And I'll have you take that foot and I'll have you push against my hand, good. In this hand, good. Have you try to spread your knees out for me, good. And bring them together, good. Strength in his knees and ankles are normal. I'll have you bring this knee upward for me, good. And again, hip strength is normal. I'll have you close your eyes for me. Tell me if you feel sharp or dull sensations.
Sharp, dull, sharp, dull.
Good. You can open your eyes for me now. I'm going to test for stereognosis and graphessia. And for stereognosis, I want you to open your hands and I want you to tell me what I've placed in your hand.
A key.
Good. And your other hand, let me see. Tell me what that item is.
Paperclip.
Very good. I also will test the vibrations. All right. You feel the vibrations there?
Yes.
Here,
Yes.
here,
Yes.
here.
Yes.
Good. I'm going to check deep tendon reflexes. Brachioradialis, bicep, tricep, brachioradialis, bicep, tricep, patellar, and radius. I will now have you stand up for me. And we will further check range of motion of the hip. I'll have you lean, yep, right, left, good, forward, and back, good. That's adduction, abduction, flexion, rotation. I want you to externally rotate. I want you to bring your right leg out like this, good, and now the left, good, and take your leg, bring it back. Good, and the other, bring it back. Good, and close your eyes for me. Bring your arms out to your side. This assesses Romberg. His Romberg test is normal. There's no swaying noted. I'll have you bend down and touch your toes for me. Curvature of his spine is normal. There is no noted scoliosis, and his spine appears to be midline. All right, I'll have you stand for me. I'll have you take a few steps back that way. Regular steps, and then I'll have you walk heel to toe, come back this way. Good, and I'll have you stop there, take a step back, and then hop on your right foot and then on your left. Good. That concludes my examination.